Welcome once again to another Friday Facebook Live with myself. I'm Dr. Shelley Glover, and once again, I'm a board certified obstetrician gynecologist that practices in Claremont, Florida, which is about 20 minutes west of Orlando. And we've been doing surviving COVID, putting things in perspective. Facebook Live every Friday for several weeks now. I don't think I caught you right at the very beginning of the virus, but we've been kind of just getting together, talking, going through what happens for the week, especially here in Central Florida, since every state is different and every area is different, and just kind of sharing information and kind of getting everything up to date. So anyway, and answering your questions, of course, which is the most important thing. So what is our latest thing for the week? So for our statistics, as we always go over, worldwide there are now 6.42 million cases and 383,000 deaths. Within the United States, we're up to 1.92 192,000 cases, excuse me, and 110, no, 1.92 million cases and 110,000 deaths. We have 440,000 people recovered from COVID-19, though, too. So that's also something very important to keep in track, is that it's not just that the majority of people actually are surviving COVID. And so that's an important fact that we never want to lose sight of as well. Within the state of Florida, we have 60,000 deaths. If you want exact numbers, it's 60,183. And we've had 2,607 deaths. The numbers are, we have had a little bit of a climb in numbers over the last week. As you know, when we start talking about testing, we start talking about numbers. There's always some variation because the more people that are tested, the more the numbers are going to, if we get positives, the more positives you can get. So it's a variation on, okay, is it really that more people are getting exposed, or is it that more people are getting tested? And sometimes it's a combination of both. We're entering into, we are now coming into the end of 2 weeks from Memorial Day weekend. We know, especially here in Florida, that there was a lot of non-social distancing going on over Memorial Day weekend. So we were anticipating that there were going to be some numbers piking up during that time. And so this is kind of going to be our reflection from things that kind of happened. And we also knew that there would probably be some numbers that are going to go up as we start to reopen. That is going to be a given as people start to go out and they start to mingle, that there are, once again, as we keep saying, there are the majority of people out there that have COVID don't know and are asymptomatic. So if you're rubbing shoulders with that person, then there's going to be an increase in exposure. So that is a given, which is why we keep stressing the whole point of being responsible when you go out. Florida is now entering into phase 2. Yay! I guess I guess there's some people that don't want to yay. I know that we have our people that are would like to still keep everything under tight wraps. But as we've said before, when we look especially in Central Florida, our numbers actually are pretty darn good. The reason why we did the quarantine and why the quarantine is important to remind everybody is the goal was to flatten the curve. It wasn't to get rid of COVID-19. We knew we weren't going to get rid of coronavirus. I wish to God we could, but that wasn't the case. The case is that we were trying to keep people quarantined for a brief period of time so that we didn't all explode at once. Kind of what you saw in New York. The reason why New York had such a problem, they're multifactorial, but one of the big reasons was that everybody started getting sick at the exact same time, and the hospitals could not handle that load. So what the quarantine did for us, and is still doing in certain places where the numbers are extremely high, is it's allowing the physicians and the hospitals to catch up, to take a breath, to be able to take care of the patients. Because if you're severely ill, you need intensive care treatment, and there's no bed available, then that's a problem. That's a big problem. And so so that's what we have to understand, is that the quarantine did work. It did work, at least here in Florida. And would you agree with that, Dr. Patty?
Yes,
Yeah.
I
So
totally agree with
so
that.
I
Yeah.
think that it. So I don't want you to think that it's failed, or that it's not working, or that we shouldn't be trying to reopen. The goal was not for us to stay hidden for the rest of our lives. So it did work, at least here in Central Florida. I can tell you, as we've said before, our hospitals are open, are ready. Their censuses are not, they're not bulging at the doors. They do not have a high percentage of COVID-19 in the hospitals. And so you can get care, you can get treatment, whether you have COVID-19, whether you're having a heart attack, whether you're having a stroke. If you need to be at the hospital, you can go.
Yes.
You're not going to get turned away, like you hear when you're watching some of the stories that were occurring in New York and places where people were saying, I was going to the emergency room, my loved one went to the ER and was sent away several times because they said they didn't have space um, for them. That's not the case, at least here in Central Florida. So we're very lucky that we are in that situation. And unfortunately, there are places where people are not still in that situation. So we're certainly not saying that this is something. Do not take the information that I'm discussing with you and extrapolate that out, say, to another place like, say, New York City, where they're in certain areas where they're still in crisis mode. The other thing that the quarantine did for us, and just slowing, was just to slow things down. We are getting more information every single day. Every single day we learn something new about this virus. And we know things now that we did not know a month ago, 3 months ago, 6 months ago. So every single day that we buy, where we keep another person out of the hospital, and we get more information on the best way to take care of this virus, is a day one. And so that's why we're still pushing that there has to be a new norm, at least for now. If we want to see good success here in us being able to go forward, until we can really get a really good handle on things, which is going to take a minute, then we want to keep as many people healthy as possible. And yes, the numbers are still holding. Once again, at least in Florida, we've got about 20% of those that are testing positive that are ill enough to require more, have moderate or severe cases. The severe cases are about 5%, and the death rate's about 1%. So the numbers are still really good. They're good here, especially in, like I said, in Central Florida, we're holding pretty nice. So our phases, and I know that every state is different. Our phase one was a 25% rollout, and then it went up to a 50% rollout as far as the hospitals, as far as the restaurants were concerned, and allowing back of opening of certain establishments. So phase two, as far as I know, and I'm always open to correction, is 100% for the restaurants, 100% for the retailers. Now, what do you call it? I like to say physical distancing. I don't like to say social distancing, because that has like such a negative connotation to it. So when we're saying that we're at 100% occupancy, there's supposed to still be parameters in place. So of course, if a restaurant was open at 100%, it can't be. So 100% now is not 100% then, right? Because 100% now involves chairs have been moved, things have been changed to accommodate that. And so you have to understand that, yes, I'm not saying that the small businesses and the restaurants and stuff aren't going to feel the pinch. Still they are. But I would say I've talked to lots of business owners, and I'm a small business owner myself, and we're just happy to be open. And functioning much closer to normal than we were. So the big things with phase two are that the restaurants are at quote unquote 100%. And the retailers, now of course we all know that there were certain retailers that were 100% all along, like Home Depot was at 120% this whole time, because everybody was out doing home renovations and stuff like that. But as far as the other stores, like your department stores and the other places that were at a decreased mandate, they are all able to be open at quote unquote 100%, with, once again, physical distancing signs in place. The bars are able to open. And so that's a big thing, but they have to have the social or physical distancing in place. So that's, but they're excited because that's a big thing for the bars to be able to open. As far as I am aware, the nightclubs are closed. Still, they cannot open as of yet. And then I think pretty much everybody's open. The massages places are able to be open. The nail salons are open. Um, I think the main restriction was the nightclubs, and maybe tattoo parlors or something like that. I think there might be a few outliers that are still closed, but the majority of our economy, at least here in Florida, is able to be open. Now, um, I think that we have to be careful, and I know that I would love to go back to just being able to just be myself and just go where I want to go and do what I want to do. I was a little disheartened this past weekend. I went to several different stores because, once again, it's still hard to get. We can get the toilet paper now. Yay. But paper towels is huge. Paper towels is really hard to get. And you're only allowed to get one, package, whether it's one little package or one big package. And once again, because of all of the things that we're doing to keep you safe in the office, we go through a lot of paper towels and a lot of disinfectant. So I have to go on hunts over the weekend because you can't get anything off of Amazon looking for supplies. So I went to, let's see, I was at Target, I was at neighborhood Walmart, and I think there was a third store. And I was just a little disheartened because I felt like we kind of switched. The first week back, I would say we were kind of at 75% practicing the physical distancing and wearing their mask, etc. And depending on where I was this past weekend, we were probably about at 25%. And so I think that there's a lot of people out there that are kind of taking the return to normal as, okay, I'm going to just go back to normal. And, there's a lot of pros and cons on that. I would just say that, as we've said, that I've had COVID-19 survivors on the show, and they will all tell you that they never thought that they were going to be positive. They never thought, it's not going to be me. And they never thought that they were going to be sick and actually experience the symptoms. So, you may be one of the lucky ones, but if you're not one of the lucky ones, statistics mean nothing. If you're the one that's sick, and heaven forbid, if you're the one sitting in an ICU fighting for your life, it doesn't matter that, the majority, 80%, are going to do well, etc. Also, what's coming out in the news now is that there's other things. It's not just the I am so sorry, guys. You're going to hear potentially some noise around here because we have some work going on in the house that was supposed to be done 2 days ago and is now going on. So please ignore any kind of random noises that you hear. The joys of doing a broadcast from home. But anyway, there are some other things that are coming out. There are people, and once again, all different age groups that are experiencing different symptoms and signs, whether it's just severe fatigue that they can't shake. Of course, we've already gone over the loss of smell and the cold symptoms, but there's all sorts of weird things that are affecting people. So it's not, and then of course the big one that we've learned more about over the weeks, which is the clotting disorder. So you've got people that have absolutely zero symptoms and then just drop dead of a heart attack or a stroke. So it is something you still have to take seriously. It appears that it's going to keep going. That it's not just, okay, if I make it through the first 2 weeks, I'm 100% safe. We don't know that. And so once again, you don't want to play that little game because you don't know. You don't have that, and we all want to believe that we're, blessed from above and then nothing bad's going to happen to us. But we've seen there are people, religious people are dying. This disease is not, it doesn't pick and choose. I mean, it is, even though we're seeing more black and brown people, that their death rate is higher and that they have a higher percentage of getting ill. That's, once again, based on underlying illnesses usually, and it's multifactorial, which we may do a show on that, I've told you. But it does not mean that if you're not in that group that you're going to be one of the lucky ones, because there are definitely people of all walks of life, all religions, all everything that get this. And unfortunately, there are people in all walks of life that are dying of this. So you do have to take it seriously because hindsight is 2020, and it's always easy to go back afterwards. I was we did a COVID-19 screening test at my church this past Sunday. We did free oral swabs, and we did about 168 people. And Rick Singh was there, who is, and I don't want to say it wrong. I want to say that I don't want to say. I forgot. He's one of our public figures. I don't want to say the wrong name, so and have people fuss at me. But anyway, it's public knowledge. But he came back positive. He was there. I mean, so you don't know. It's not like he was healthy. He was standing there. Thank God he wasn't standing close to me, and I was in full PPE, so I feel pretty good. I was pretty bulletproof while I was there. But he was there. And people think, oh, public figure, go over there, take a picture, be next to him, how great, right? And he was positive. So, and no one knew because that didn't come out until 2 days later. So you can't assume, I'm sorry, you have to assume that everybody that you're standing next to that is not, in your house, and that's always suspect too, can potentially be positive. And that's how I look at life. I've told you that before. I assume everyone is positive until proven negative. And even when you're proven negative, once again, with the testing, etc., they're not 100%. As you know, we had Krista on the show a couple of weeks ago. She tested negative twice, and she definitely had COVID-19. So you don't know. So you have to treat yourself and handle it and do the best you can with the knowledge that you've got. And that's all we can do. As far as the office goes, we are, quote unquote, at 100%, meaning that, as you guys know, we are still a small business. We did have to furlough staff. We did have to close down, cut down our hours. And we were only there a couple of days a week. We are now technically operating on our regular schedule. The only difference is because telehealth is so popular, Fridays, whereas I normally would have been in the office seeing patients in the office, now I'm doing telehealth. But the girls are still in the office. So there is someone in our office now Monday through Friday. The phones are being manned. Now, I ask you to please be patient with us, even though we are, quote unquote, back to normal. We are still functioning with a lower staff, and everyone wants everything now. And we also still have, we call it COVID brain because it's getting back into the gear of things and stuff. So we still have to even though we're all healthy, please don't go out and say we have it, we don't, and we have tested the staff. But even though we're all back, it's still getting back into that groove. And it is a different groove, because we require it. I'm going to tell you right now, we will send you away because we did send one lovely lady away. We are serious. My girls' health is very important and your health is very important. And so we have protocols in place. They are not difficult protocols. And if you want to be seen in my office, you're going to follow the protocols, or we can reschedule you for later whenever this all blows over. If you don't want to wear a mask, if you don't want to wash your hands, and if you don't want to practice physical distancing, then my office is not the place for you to come. And that's just going to be, we don't make exceptions. I don't make exceptions for myself. And I expect you to do what is right as well. We call it social responsibility. And that's what I anticipate from all of my wonderful clients. And we've only had one person object. So I think that's pretty darn good. But be patient. We do have some disgruntled people that are saying, including my husband, he says, I called and nobody answered the phone. I said, well, let it go to voicemail and we'll get back to you, bud. So we're trying the best we can to get everybody taken care of. And I think we're doing a pretty good job. So bear with us. We do have a new esthetician coming on Monday, so we're really excited. Her name is Kelly. And we are doing, as I said, we're back to full operation. So we're doing all of our elective procedures. We're doing our surgeries. We're doing our annual exams. This was our first week back doing all of our annual exams. So we're really, really excited to be able to offer all of the things that we're able to do in the office before COVID, post-COVID. And we're also, just so you know, I am always looking for the perfect mask, because I have to wear them all day and it drives me crazy too. So don't think it doesn't drive me crazy. And so if I do ever get to the point where I find a really good mask, you guys will be the first to know. But we're still, I've gone through quite a few. So, and I still think the cloth masks are the best thing. But even with those, I still haven't found one that I think is the best. And real quick before we go forward, I said, let's see. Beth says, "I wish I knew about paper towels." Oh, you would have brought me some. You guys, let me tell you what I need. So, if you have Clorox wipes, if you have paper towels, what else do we need? That's the big thing. We don't, that's the really hard thing to get a hold of. Lysol spray, Lysol cleaner. If you get your fingers on any of that stuff, bring it to me. We're actually going to be okay on disinfectant wipes. Our bigger corporation actually did get a hold of those, and so we will have the wipes, the disinfectant wipes to work with. But if you have the actual cleaner, and if you have, what was the other thing? Paper towels. So I'm good for the moment. But yes, please, if you're out and you find cleaning supplies, now remember that a lot of the natural stuff does not have the antiviral. So you'll find, I forgot the name. There's a lot of the stuff that's usually sitting on the shelves still does not have the antiviral properties to it. So just read the label because I do have a bunch of that stuff already. But yes, I would love you madly if you guys find it. My staff already knows that. I'm like, hey, if you find it, you know what I want too? Like the little packets of oh dear Lord, now I'm messing up on the name. Wet, the little ones, the little guys. So the little packages, not Clorox wipes. They're Wet and Go, something like that. I think you know what I'm talking about. So I would love some of those as well. So anyway, that's what I've got for this week as far as the updates both to the office and as far as the updates to Central Florida. And today we have a great guest that has joined us, Dr. Sangeeta Patty, and she is an obstetrician gynecologist by trade as well, who practices regenerative medicine and is really excited because, as you guys know, I'm fairly kooky and we have about 14 different supplement lines, but our main line is actually MD Prescriptives, and she is actually the founder of MD Prescriptives. So this is a chance where you actually get to talk to somebody who actually developed a supplement line and why, and we get to ask her why, and we get to talk about immune protocols. As I told you before, there is stuff out there that is working well, and so MD Prescriptives has some really great immune protocols. If you're one of my clients already, you're on most of the stuff in the basic immune protocol already. Probably besides the silver, but I'm going to let her talk to us a little bit, introduce herself, and tell us a little bit first about why she started off with nutraceuticals and getting things and developing this line. And then we'll talk a little bit more about some of the immune protocols and things that are out there to boost your immune system to help you be the healthiest you can. So that, heaven forbid, if you end up with COVID or any other thing that's out there, flu's coming not too long from now as well, and there are other bugaboos that are always coming on the horizon, that you're healthiest and your immune system is at its best. So, Dr. Patty?
Thank you. It was really enlightening to hear your summaries of this week. I wanted to take notes. Great summary. Really, really great summary. So I think, it is obviously one of the things that we know that we have to pay attention to is where our immune system is. And when you were talking about some of the positives of what has come out of the quarantine time, I feel that one of the positives is that all of a sudden we find ourselves paying attention to some of the things that really do matter, whether we have COVID or don't have COVID. We've actually had some time to self-reflect on some of those things, including where we put our time, our lives. I feel that, if you really look at modern society, you find that the way that we've been living our lives is not necessarily sustainable. So I'm not necessarily interested in all of us going back to a normal that was exactly like it was, but more something that's more optimal for human life and human immune system for that matter, because that's really what I feel we see anytime any kind of virus comes into the air or any kind of infection is if we have a strong optimal immune system, then we're really not compromised. There's nothing to worry about. And that's what's so nice, Shelley, about what you're doing, because, knowledge is power, and knowledge is the power to choose what's right for you and what's your truth. It's not about just accepting everything everybody says, but, you get to the point where you're like, okay, I know how to handle this. I know what I need to do to keep my family and myself in the strongest place immune-wise and strongest place health-wise, so that I'm not, I'm healthy, I'm happy, energetic, and don't have any chronic or acute diseases. So getting to the question that you asked me about the supplement line. So it was interesting about 16 years ago when I stepped into understanding that the training that I had in pharmacy and surgery wasn't really enough to allow the body's self-healing mechanisms to turn on. So I started to look for ways to help people get empowered to be in the driver's seat for their own health. So they really need less and less of us. And if you look at the long living cultures, you'll find that they don't really have cellular aging until the age of 70, 80. So it's really possible, and they're climbing mountains and tending to goats and extremely functional, having sex until way into above their 80s. And I just researched this because I was preparing a talk for one of the conferences. But it's really true. The better we connect to the natural sources that we were given, the more we realize that we have the ability to heal ourselves, and that we have the ability and the gift to heal other people. So when I started that journey in 2004, I am a gynecologist, so it was really easy to start with bioidentical hormones. And I was like, okay, people would come in for hormone balance, and that would be the end of that. But what became really clear real fast is that if you are starting to balance ovarian or adrenal or thyroid hormones, each one of them ends up needing specific nutrients to activate it. And for example, the thyroid needs selenium, zinc, and iodine to be active. And our adrenal cortisol system needs a certain amount of vitamin C, active B vitamins, and magnesium, magnesium, magnesium. So when I realized that, I started to look for the right supplements to put people on. And it was easy to figure out that although food is really the primary thing that you want for the nutritional piece, because, food is packaged by nature in a way to make everything bioavailable. So, you can't really replicate that with a supplement. Right. But when we started measuring people's numbers with something called SpectraCell, we realized that, you've got to put the supplements on board. So I started looking. And I started to realize that, there was a study that had come out, 95% of the supplements were contaminated. They had dyes and fillers, and they weren't triple tested, and they were heat sealed, so they were altered. And they didn't have biologically active forms, nor the doses that one needed. So in order, for example, for a patient to get activation of the adrenal thyroid axis, I would have people walking out with literally 5 bottles, like zinc, selenium, then the active Bs, then a multi that didn't have everything, and then iodine. So it was really clear when I went to a couple of supplement companies and said, hey, can you make me, a supplement that has all this stuff in one bottle? And is it possible to take this junk out, especially magnesium stearate, which they use as a flow agent, but it turns out that it's a toxin. And it's actually listed as a hazmat, a hazardous material, if you look at its actual classification. So I was really blessed because I was working with people who knew how to make supplements, and eventually I realized that if I was going to get the kind of supplementation that I would use myself and I would use on my family, and I could safely and with a good conscience recommend to patients, I was going to have to do it myself. And in fact, nor did I have the business acumen to do that, nor did I ever really want to do that. But it turned out that was 2008, and actually most of our testing occurred for 2 years before that. So this line has been around now for 14 years. Wow. And the whole goal was to make the cleanest thing that we could give you, and to put it in a glass bottle with, really, exactly what you need, so you don't end up having to take 10 bottles of anything. You're taking a couple of bottles of something, and it is a clinical line, which means that you're being helped by a clinician to know exactly what you need. It's not like going to Amazon and you buy one thing and then it's you might also like, and you might also like, and you end up with a cupboard full of supplements and you don't know whether they're even doing anything. So that was how that began. And I would say that one of the most important things energetically of this line is the love and the, real integrity and conscience that we put into making it. Because, we visited all the places, we pray on our supplements, make sure that they're high vibration so that they have a great effect.
Cool. Well, I always tell my clients, I say, holistic doesn't have to be a whole lot of things, and you get people that come in literally with a shopping bag full of stuff.
Yeah.
And I'm like, you're not only are you taking whatever you think you're taking, and then there's always the question about whether it's actually even in there. Because as we know, they pull these things off the shelves and do random testing, and a lot of times they don't even have the active. They may have started at some point with the active ingredient, but by the time it's formulated and done all the different things to it, it's not even there, or it's there in negligible numbers. But you're also then ingesting all the fillers and the preservatives that go with that. So if you're taking 20 things, you're also getting all of that other stuff, and your body just cannot process all that stuff, and it's not good for you. And so that's what I always tell them: let's get you on a simplified regimen. I think that, and maybe you can answer this. I mean, we're going to get into the immune stuff, guys. Don't worry, no fret. But this is I got her hostage too, so I get to ask some questions. So one of the things that I always find amusing is that there is almost like a fear of the multivitamin now. I find that I will have clients and they're like, well, I take vitamin C and I take D and I take this and I take that. And I say, but you're not on a multi. And I say, there's a reason why they developed a multivitamin, so you wouldn't have to take 20 different things, and so they would all be in there together, and you're not dealing with, your body having to ingest, a pill box full of vitamins just to get to the multi. So I think that my thought process is that the distrust of the multivitamin came from the understanding that a lot of them aren't very good. That's all I know. I mean, I don't know if when you were actually developing the line, if you came across that, or if your clients say those kind of things to you. But I find that even in my people that are conscious about being, trying to get their health together, that a lot of them are not on a good multivitamin.
Yep. Yeah, I think you kind of hit it on the head. If you look at the studies, and you look in 2002 when JAMA actually published a study, and their statement in the title was that multivitamin supplementation may be required to prevent chronic disease. That was the very first time that I ever saw anything that talked about a multi. But then there have been hundreds of studies behind that, and before that, and even after that, that have actually shown that a multivitamin did absolutely nothing. And so when I was looking at them, I realized that there were several things that were a problem. First of all, the number one multivitamin that was sold on the market had dyes. 3 of the dyes were listed in National Cancer Institute's list of the carcinogenic agents. They had fillers, magnesium stearate. They had forms of the vitamin that weren't active in the body. Like you would find cyanocobalamin for B12, and that means the body has to break it apart and then put methyl on it in order for it to actually work. And then they had 6 micrograms of cyanocobalamin. And if you look at what the human body needs to correct to the 75th percentile, which is where you want to be because that's where you're going to prevent disease, you need about 2,000 micrograms of methylcobalamin, somewhere between 1 and 2,000. So I feel that what happened in the original studies is you had all this junk in there, and a lot of times the junk that was on the label wasn't even in the vitamin. 95% of the time, as you were saying, that was reported by Consumer Reports in I think 1995. And so I realized that you really do have to pay attention. Like I've been into the manufacturing plant and taken a look at everything that they do, because we're picky polys. It's like, I don't want to swallow anything unless I know that, what it was made out of. So the multi, I agree with you, is completely underutilized. And obviously, if you're measuring, suppose you measured your nutrition and you found out that, hey, I'm above the 75th percentile for everything, and I'm just eating my food. I'm eating organic food because it's 30 to 40% higher in nutrients, and I'm getting everything I need. I'm eating 8 different colors of the rainbow, and I've measured, and I'm good. But what I've found, and the reason why I'm comfortable telling everybody across the board to stay on a basic multi, is because after measuring thousands of those patients, we found that there aren't any patients that we're able to find now that are really corrected. And it's interesting because I think what's happened is that we're talking about what the USDA reported, which is that 50% reduction in all the nutrients across the board. So we're kind of stuck in a position of having to take something and you want to make it the minimum. So I think like a multi, and especially the ones that we recommend, they do have all of the B vitamins in its active form, which means as soon as you take it, you're going to feel it, and you're not going to be depending upon your body to convert it to an active form, which is called 5' phosphate. So it's similarly, like all of the minerals need to be in the forms that the body wants to view it. It's almost like looking at it as a bioidentical nutrient.
Right. And so then when we're talking about the immune, things to boost our immune system, so we've already on other shows we've talked, or brushed on, the fact that we want to lower our stress levels, how important that is, and that sleep is extremely important. Sex is actually a very good de-stressor, and it's not, and I'm not trying to be funny, it actually really is. So don't negate that. Don't, especially for our females, don't push the man away. It's actually a good thing. Not obviously the stress levels have been extremely high. My stress level has been outrageously high, over the last 2 weeks between the reopening, the staff, all of the stuff going on with the protest and all of the social things that are going on. So, you gotta, so I have to work on myself as well. But I think but that's all tied in there together. And then we also have, we can also look at, and you're big on that, and all of the energies and all of that. So just so like you said, just putting ourselves in a place where we're able to be healthy. And I think that I agree with you that one of the things that a lot of people hopefully that got out of the quarantine and are kind of forgetting already, is that it got you back to nature to a certain point. You couldn't go anywhere, so you were actually you realized you didn't have to be in your car. You didn't have to be, hopefully, God willing, on a business call every 5 seconds. You didn't have to be up in a plane, and that you were able to actually take some time with your family unit and in your home and just let go a little bit. And hopefully that also was associated with a little bit of the decrease in stress, as long as we didn't go the other way. I do have, of course, the patients that were really petrified of COVID, so their stress level went the other way because of their fear, but I think that that's really important, that we do, like the new norm, includes not forgetting that little bit. Don't forget that. Don't go back to business as usual if business as usual was you burning the candle at both ends, because life is short and then you die, and you don't, and that's one thing. If you talk to these people that have gotten severely ill and have made it through, and obviously certainly their job was not sitting at their bedstand. at the foot of their bed. And unfortunately, with COVID, nobody's sitting at the foot of your bed. But you just have to realize that sometimes it takes a near-death experience for people to really understand what's important in life. And this is our chance to not let that happen, to not have to get to the near-death experience, to allow this to be our experience to say, hey, what's really important in my life? And where are my priorities? And I'm seeing some of that. I'm seeing even I have a good friend of mine who's a physician, and he's basically said, "This is I'm cutting back on my so we were forced to cut back on our business. We didn't have a choice, but he's deliberately not going back full forced. He said, I'm not going to go back to working 5 days a week and then doing administrative stuff, over the weekend and then traveling and doing all that. And he's deliberately cutting back and slowing back, even though, quote unquote, the go ahead is to go back. So I think we really want to take that into account and realize how important it's not just something that you're going to get out of a bottle, that it has to be a lifestyle change. And if you've ever been to somebody, you'll hear from me, but also any of the regenerative medicine doctors will tell you that. And a lot of people don't want to hear it. They don't want to hear it. They want to get the bottle, give me the medicine, let me take this, or let me take the supplement, and let me continue to do the things that I know are detrimental to me, as far as my stress. And I will tell you, when I have clients that are in high stress jobs and they get out of that job, it is night and day. It is night and day on their health and their well-being. It's amazing. So it's scary, it's hard, but a lot of people are uninsured. I mean, not uninsured. A lot of people are, we just froze. That was weird. A lot of people are unemployed right now. Okay, so that's a very scary thing, and I get that. And as I told you, we had to furlough our staff temporarily, so I get that, and my staff definitely gets that. But when it's time to go back, if you're furloughed and you have a job, then by all means go back to that job as long as it's something that you enjoy. But if you're unemployed, this is a time to explore. What is it you want to do? Maybe this is a time to do something different. Maybe don't go back to that job that you hated. So take this time to explore. The internet's your friend. Go on and they actually have career builders and all sorts of things where you can type in the things that you like to do, and you might be surprised, and you might find something else completely different, than you would have ever dreamt that you were able to do. This may be your opportunity. So, done with my little rant. I'm going to turn it back over to you.
I love that rant. That's not a rant. That you nailed it. Simplifying our lives really it makes it so that your body's fuel tank is able to match the speed of the engine. Our speed of our engine, our mental and physical stressors have been driving the speed of the engine too fast for what the body's fuel tank has in terms of hormones and nutrients. So the more you balance your life, and that's where I would start it. Like I started with balancing hormones and then quickly realized that you can't balance hormones unless you also balance life, because it's the speed of your life, your thinking, your emotions, the amount of things you commit to that actually determines how much fuel, like how much cortisol or how many B vitamins you actually need.
There you go. Yep. So would you like to tell us about the immune protocols that MD Prescriptives has?
Yeah, I can tell you about them. And the nice thing about these is that these immune protocols actually were developed almost 10 years ago, and they've been used for just that long in thousands of patients. So they were not necessarily thrown together with the current circumstance, but they were shared widely in the current circumstance. So there are some basic things. So you want to definitely have a basic multivitamin that has the 25 of zinc that you need, and the 200 micrograms of selenium that you need, and the active B vitamins, and the certain amount of iodine. Because if you look right now, so the interesting thing is, I was telling you about all the studies that showed that things didn't work. You would not believe, over this last 4 months, the number of studies that have been published showing that nutrient values in the 75th percentile are actually protective for your immune system. And there's dozens of studies showing this right now. So, so definitely an active multivitamin that has all the active B, certain amount of selenium, zinc, and that's something which, you can connect with Dr. Glover on. Then the second thing, and that's something that you should take regardless. The second thing for the immune system would be a very solid probiotic. And you want not only a high count, but you also very much want to use something that has all of the species that you were originally born with. So, when we're born, there's a certain amount of bugs and certain bugs that are passed on to us. So probiotics, so these two things are something that everybody should stay on. These are staples in our program for everybody. Then the third thing that we recommend is people keep their vitamin D level above 70. Yep. And the normal range is 30 to 100. Most people will not have a number of 70 unless they're actually taking vitamin D. And the interesting thing is that over the last 2 weeks, they've had 2 published studies and that are adding to evidence about the fact that you really need to be in the 75th percentile. You need to be in the upper end. And what they've tried to do is there have actually been physicians now who have put in a recommendation that the normal ranges are changed because those normal ranges are too low. And we know that the severity of any infection, any kind of pneumonia, any infection is cut down by over half just by having a vitamin D level that's above 70. So I talked about a multivitamin that was broad spectrum with the minerals. I talked about a probiotic, and I also talked about the vitamin D. And last but not least is bioactive silver. And bioactive silver, really silver has been used since, thousands of years ago to keep things sterile. If you look at, people used to use silver vessels just to keep things sterile. So it turns out that over the years, people have figured out how to actually solubilize that silver in a way that it's a very, very small particle at 23 parts per million or 10 parts per million. And these silver molecules have been shown to be extremely safe. In other words, you would have to be taking them for 70 years before you even got close to the what they call is a dose that would be too high, and you'd have to be taking over 70,000 doses. So we know that it's extremely safe, and also that it shows broad spectrum activity against all kinds of infections across the board. So I would just say that these 4 ingredients are really the base of a basic immune supportive program. And then, of course, there's more advanced things. And so what you try to do is keep yourself out of the hospital, keep yourself out of, as Dr. Glover was saying, you're shoulder to shoulder with someone. Well, we don't know who those people are. So are we going to walk around in fear all the time? Absolutely not. What you're going to do is you have taken this time when you're quarantined to hopefully get more sunshine, which means your immune system is already better because you lowered down the number of things you were doing. You connected to the sun. Hopefully you got a little naked and went barefoot in the ground and grounded the electromagnetic fields that are man-made into the ground, which is critical for your immune system, drank water, breathed, and most importantly, stayed in what we call the vibration of joy, which actually controls all of our genes and controls all of the immune processes in the body. So doing that and then taking some things that additionally boost our immune system makes it so that we should be able to comfortably, with security, return to the kind of activities that we want to do without worrying about these kind of things. So if you happen to get any kind of infection, the protocols are a little bit more aggressive. And those are things that you can also see on Dr. Glover's website. So
hold on, let me unmute myself. Are we good now? Can you hear me?
You are. You're
good.
Perfect.
Good,
we can hear you.
Good.
Yes.
Good. So yeah, no, I think that that's great. I think that that I was trying to make sure I wasn't making too much noise, so that I had to remember to unmute the buttons. So anyway, I think that's great. Do you guys have any questions about the basic immune protocol? Let me see. I have a question from Muriel, she says, I've heard some take prenatal vitamins but are not pregnant. Is that okay?
So it's exactly what we were talking about. And I'm an OBGYN, and I know you also, Dr. Glover, have had this experience, but it's unbelievable when you start measuring blood levels in people who are pregnant on prenatal vitamins. It doesn't correct anything. It has the same carcinogens in it. It has the same forms of vitamins and minerals that don't actually work in the body. And in fact, there have been many studies showing they make no difference. But no wonder they don't make any difference, because they really don't have barely. Imagine a multivitamin and a prenatal that has maybe 10 or 20 micrograms of B12, and what you need is 1,000 to 2,000 to correct the kind of deficits that we're seeing these days. So absolutely switch that.
Right.
Yeah,
And
switch
I have
that.
patients that, well, I don't do obstetrics anymore, but we have our gynecology patients, when we get them, I always tell them I'll get them to the pregnancy and they can come back afterwards. And we have plenty of them that we have on the, MD Prescriptives Essentials, along with their vitamin D, along with their probiotic, and we carry them straight through, and I'll put them on the iron, and I carry them through on that. And I tell them, this is actually an excellent protocol that you can carry through the pregnancy. And they do, very well with it. And they don't also get the stomach upset and the nausea and stuff that you can get with the some of those prenatal vitamins that are out there, and the constipation. So.
Yeah, and I didn't mention there was another study that was just published a few weeks ago that showed that in order to actually get a full immune benefit, you really have to be in the upper quartiles. And they were able to show that the WBC response, all of the immune cell responses were really optimal when you got into that optimal range. So again, if you got the luxury of testing, you should test. Either with any test you can do, either SpectraCell or there's a nutrient panel that you can get from Genova Diagnostics. But I can tell you that most people need something. And the nice thing about this quarantine time is that the number of days that it takes for you to actually get nutrients intracellular is somewhere between 90 and 120 days. That's the reason why we never repeat those tests very quickly.
Right.
And the reason why this is great is because what we're finding, as Dr. Glover talked about, is that there's a whole sequence of things that happen after COVID and after any kind of infection that doesn't go away. Like there's all kinds of symptoms that have to do with fatigue, especially. And I can tell you that that has more to do with the resilience that the body had to begin with. Like, what were the B vitamins to begin with? And what was the zinc and selenium levels? And what was the status of the adrenals and the thyroid? So that's how you're going to stay well.
Right.
You're going to stay well by staying on certain things that carry you through from preventing any disease or any acute condition to through after. That's why there's maintenance.
Maintenance, right. And that's what I said. I mean, everything, pretty much all of my clients are on the basic immune protocol anyway. Besides the main thing was the silver that we didn't have in our arsenal, which now, of course, we do. And we offer SpectraCell testing. Of course, sometimes that one can get pricey, but now SpectraCell, it used to be much worse, and now most of the insurance companies are paying for it. It's not cheap, but it's actually not bad. It's under $200 usually with the insurance companies to do it, and I always recommend it so you can kind of see what your levels are. There's nothing, knowledge is power. So a lot of people think they're on these great regimens, and I like to say, let's see how good it is, because it doesn't, hey, if it's working, that's fine. If it ain't broke, we don't have to fix it. But normally when we get the levels back, we find out that what we thought was so fantastic actually wasn't really necessarily cutting the mustard. And then Tanita says, great information. I feel better now about going to the beach, de-stress, and you are absolutely positively right. And Dr. Potty would say, put those feet in the sand. Do not walk around in sandals unless you're going to burn your feet, because you want to be one with the earth, right?
That's right.
And if you're going to run out there at night, and you can take off your clothes and be one with the moon, and as long as you don't get arrested.
Yeah.
We don't want you coming back and blaming us if they come and take you away. But anyway, but now what about, okay, so let's talk real quick. And then I know we're coming up on the bewitching hour. Oh, we are at the bewitching hour. So real quick, but we have 7 minutes because I blew it in the beginning. But real quick, we have our school teachers and our frontline workers, and so I'm getting the questions about, okay, so you definitely would say that for our people that are, so obviously everyone can be on the basic immune protocol, that's for sure, but I would assume that you would definitely say that that would be a really good thing for them, because they are out there, they are being exposed. And so I am getting some of my teachers saying, okay, I want to start getting ready for the school year because God willing, these kids are going to be coming back into school. And I want to have my immune system. First of all, I don't know how you work with kids and not have your immune system optimized. I mean, when I first was in training, every time I went on the peds ward, I would get sick. So I was definitely not where I was supposed to be. And so you
didn't have enough sleep to be.
Well, that is true. I definitely was sleep. In residency, you would definitely sleep deprived. But I mean, I would just catch everything. I was sick the whole time I was on peds. So I think that the basic immune protocol would be a great thing for everybody, but definitely for our frontline workers to help to start boosting you. And you do, especially like if you're looking at the fall. So if you're looking at now, great. But even if you're looking at the fall, this gives you pretty much a 60-day window to kind of start revving up for then, right?
And I think what you said was so important in the beginning, because you can always take a lot of things, but it has to be followed with the basic stuff, like getting into the sun, balancing your life, breathing oxygen. I mean, 68% of the elements in our body are oxygen, and we just don't breathe. Drinking 100 ounces of water with pink salt and lemon to raise your pH, staying in a place of joy and balance. So all of those things are really important. And I think sometimes it can get overwhelming because you hear things like this and you're like, oh my God, I got to do all this stuff and I got to take all this stuff. And I think the way you have to look at it is, if you do even one thing, congratulate yourself, pat yourself on the back, because the way it works is really that energy flows where your attention goes. And if your attention goes to everything that you're not doing, that grows. It's like training your dogs. If you give all their attention to when they go to the bathroom in the wrong place, which I learned very quickly with 4 dogs around here, you might have heard them barking in the back. But if you give them a lot of praise for what they did right when they went in the right place, then that's what grows. And human beings are exactly the same. Children are the same. We're all the same. It's like if we really congratulate, hey, you know what? Today, I drank 60 ounces of water instead of 30 or instead of 40. That's huge. That's huge. 70% of my body is water. So I'm feeding my immune system. So these are all lifestyle changes that don't come overnight.
Right.
There are things that you have to work on slowly, and you've got, Dr. Glover to hold your hand through this kind of stuff, because it's important to get to the point where you are your own health person. And then you come to people who know how to hold your hand and partner with you to empower you to be in that driver's seat. So
I like what you said, a place of joy. So that's important, people. A place of joy. You've got to be happy. You've got to figure out what makes you happy in life. I enjoy going to work. I tell my staff, I want you to be happy coming to work. You shouldn't be here if you're not. Because life, you spend too much time at work, most of us. And so you have to enjoy it. And you have to enjoy home, and you have to figure out what it is that you enjoy doing, and don't put it off. I think another thing that we found today, unfortunately for some people that have succumbed to this virus, they were completely fine, and a week later they're not here anymore. So you don't know. Tomorrow's not promised. Having been through several natural disasters, hurricanes, earthquakes, you name it, I learned that early on. Material things mean nothing. They can be dashed in a minute. And what's really important is you and your health and those that you love. So putting that in the forefront is really important. Really quickly, let me see. Tanita, I'll answer your call. So the short answer is yes, the protocols are safe to use year-round. This is not something that you only need to use in a certain, like Dr. Patty said, this is something that's been developed 10 years ago. So this is not something just they just came out for COVID. These are not COVID protocols. These are things that will help to boost your immune system, that would help with you if you end up being exposed to COVID. But it's not just for COVID. Colloidal silver. Beth asked, is colloidal silver the same thing?
So it is a form, the silver that we talk about is a form of colloidal silver, but there's many different varieties, and you definitely want the one that's nanoparticles. And there's very few products that are out there that are actually nanoparticles. And the reason why that's so important is because as the size of the particle becomes larger, you have more chance of having argyria, which is turning blue. And nobody wants to turn blue because it's not really reversible.
Oh, so no, it's not. Wait a minute. Say that again. It's not reversible?
No, it's not well reversible. So I really stick to the ones that are the 10 and the 23 parts per, anything below 25 parts per million. And then you can drink a gallon and nothing will happen. So, except for good things. So, yeah. Yeah, I don't want to be blue.
Oh my God. Well, that's good to know. Thank you for bringing that up. That's kind of important for all of us to know. So we have, just so everyone's aware, I actually was finally able to get the MD Prescriptives link up on the website. So if you go to the Your Body in Balance Claremont website, you go under products, then you will see an MD Prescriptive link, and you can go there. And the immune protocols are actually sitting there on the website now. And there are protocol manuals also as well. I recommend that you actually contact the office, and then we get you scheduled, and we do a telehealth consult with you to kind of just go over what you're already on, what's going on in your life, and figure out what the best regimen is for you. But they are available. You don't have to. So if you don't live in Florida, you don't have to fret that you have to come to the office to buy the products. The products are available directly off of the website. And the silver, both of the silvers that that Dr. Patty recommends are on there. You didn't talk about the difference between the two, did you? You did briefly.
So there's 10 parts per million and 23 parts per million. 23 parts per million is a little stronger. Mm-hmm. And 10 parts per million is a little weaker, but they're both excellent. There's no, that's where you want to be. Right. You don't want to be in, there's a lot of people making silver even at home. I've heard of some people making it. And then you look at it under the way you tell is you look at it under an electron microscope. That's how you have to look at it.
And we all have an electron microscope sitting at home.
Yeah. But anyway, when we did the studies, and we've been looking at them, and actually Dr. Apsley, who initially worked with the stuff, they looked at all the different silvers on the market under the electron microscope, and that's how they were able to figure out what the difference is. Yeah.
I have a question from Krista. Krista says, "Hi, Dr. Glover. Any recommendations for immune protocols while taking the Pradaxa blood thinners and Vimpat for seizures?" So I guess what she's trying to say is the immune protocol safe for with medications? Is that, I assume that's what you're trying to get at, Amy?
Yeah. I mean, in general, the answer is yes. I haven't really found many circumstances where just boosting your immunity is a problem, because that's general. But I do think that there are a lot of individual variations, and I feel that it is important to have some kind of a short consult of some sort to evaluate everything, because the answer isn't always, oh, take this and take that. There may be other risks in your life that are putting you at risk for a lot of different diseases that would take a higher priority. So having that discussion with somebody who's thinking in a holistic manner, considering your life circumstances and your diet and your stress levels and your oxygen and your water and your hormone status, that's what you want. You want something that's complete, if you really are looking for something that is not just for your immune system, but just to turn on your innate self-healing mechanisms for everything,
And one more thing. So the advanced, you have the basic immune protocol, and then there's the advanced immune protocol. And the advanced immune blah, 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 blah. That one actually has very good things in it as well, that anyone could take. So why is one like, so why did you say basic versus,
Why are they different?
right?
Because first of all, we're big fans of making sure that people don't have to take a whole lot of things, and also being sure to pick the least number of things, not just for the convenience of not being able having to take a lot of things, but you also want the price point to be somewhere where we can broadly apply these things. So the basic is very, very corrective. Now, the advanced helps people who have developed symptoms, and that doesn't mean it's COVID symptoms or anything. It just means that any kind of symptoms, colds, coughs, headaches, because you can know that there's some kind of virus going on. So if you want to squash it, you're going to advance what you use. And there are circumstances where I've even told somebody who has no symptoms to use some of those things because they might be at more risk. They might be somebody who has a clotting disorder, and I definitely don't want them to get it. So there's things that you do differently, but mostly that's for people who have symptoms.
Right. And I think that once again, if we do a consultation, then I'll be able to kind of go over things with you.
Or
and stuff
high
like that.
risk, high
Yeah.
risk.
Yeah.
People
And
who are at high risk.
yeah.
Like if you happen to have, for example, if you are battling cancer, I would consider you to be at more high risk. So I would do more than some of the basic things. I would be recommending different things based upon your specifics.
right. Right.
Yeah.
Right. Well, I want to thank you so much for coming on. I think that it's a really important topic, and I think that we've gotten lots of hearts going up and thumbs up. So people are really excited to hear what you had to say, and I'm really thankful that you took the time for the day. And I'm sorry, guys, once again for the mishap in the beginning. But technology. So all's well that ends well, right? And
Yes.
so
And
once
thank
again,
you.
I wish you guys a wonderful weekend. The beach is your friend. Get out on the grass outside, get out and get your oxygen. Do your deep breathing, de-stress, de-stress, de-stress. If you're interested in learning more about the protocols, give the office a call, 352-243-6686. We can get you set up you don't have to come in. Telehealth is great. I actually prefer the telehealth for the consultations because we don't have to worry about mask or any of that stuff, and it's just more relaxed environment. And let's start getting you feeling better. And just remember, if you go to the beach, just maintain your distance. But it's not that the beach is a bad thing. The beach and the waves are wonderful. That's my go-to de-stress place. So I wish you a wonderful weekend, and once again, always wish you good health. Take care, and thank you so much, Dr. Patty, for coming.
Thank you. Thank you.